have.
Ooh.
Paul Watson.
Hi, Paul.
Hi there.
Hi.
Hi, nice to meet you.
Welcome. Nice to meet you.
So, Paul,
Yes.
you're head of healthcare at Hitachi.
That's correct. Yeah, Hitachi Consulting, yes.
Hitachi Consulting.
Yes.
So tell us a little bit about what you do at Hitachi Consulting and how you're working in the healthcare sector.
Okay, so Hitachi has a global healthcare business spanning running hospitals, IT and analytics, so looking at clinical analytics, and also sort of creating new treatments and pathways for people. So we work with our global colleagues in those areas, trying to bring forward solutions relevant to the UK and broader Europe.
Fantastic. Are there any particular projects that you've been working on at the moment that are exciting, using some new technology, something you can really tell us about?
So the latest one is around digital diabetes prevention, so offering remote lifestyle behavioural change intervention for people at risk of type 2 diabetes.
There you go. Perhaps we should introduce Paul to Sean.
Yeah.
The behavioural change. He runs an ad agency. It was our first interview today, but he was very much about how do you promote positive action and positive change. So tell us a little bit more about how you're doing it in this project.
Okay. So Hitachi has a history of delivering wellness programs in Japan. And in about 2012, we came over to the UK and we started to work with Salford Royal NHS Foundation Trust, really looking at how we could apply digital to existing pathways for diabetes prevention. That was the proof of concept was successful, and then we moved into building a digital solution, really looking at how do you increase the reach and accessibility of prevention pathways by, wrapping traditional forms of prevention with digital technologies.
So what were the issues that you identified with the original processes?
So I don't think there's essentially issues, but a lot of the sort of traditional treatments around group therapy, they require patients to travel to site. It means that it's quite manually intensive in terms of the time, the planning, the facilities, all of those things. And actually some patients are quite hard to reach. So what digital is about really is about improving accessibility to people, not just by location, but by ethnicity, socioeconomic groups, age, different health conditions, and actually being able to deliver those same prevention pathways, but at distance, so they're not required to travel in for one-to-one sessions with clinicians and health advisors.
Diabetes can be a tricky one to manage because it's not always obvious. The damage that's being done can be quite subtle for many years, especially for younger people actually, to understand the consequences of not managing it effectively every single day. And obviously it takes a lot to manage diabetes.
Yeah.
It takes a lot of commitment.
Yeah.
So how do you approach those issues?
So I think our sort of fundamental belief is that pathways have to be personalised. So everybody's different, so different ages, different types of comorbidities and medical conditions. And then with prevention, it's all about lifestyle. So it's about what you eat, what types of activities you do and you can do. So actually, when you're looking at how to apply digital, you need to be patient-centric, and you need to be thinking about how you still enable digital technology around the patient so that they're comfortable using it, that the types of intervention that are being offered are suitable for the patient as well. So what types of activities should they be doing? What types of diet should they be modifying to? What I eat is probably completely different to what you eat and what a lot of people eat. So actually giving advice on new forms of diet needs to be relevant and acceptable and adoptable by people.
And do you deliver those services through sort of web-based applications and information portals, or do you go to mobile applications or combine them? How do you actually deliver the endpoint?
So our service is actually a hybrid service. So we have a digital solution that uses responsive web design so that it can fit to pretty much any browser or tablet or mobile device. So we're not trying to dictate the phone that someone should have or what devices in order to take part. And then we combine that with telehealth, so actually professional health coaches who are receiving data on the patient through their interaction with the solution, being able to understand if they're doing well or maybe they need additional support, and then actually using the application to allow patients to self-manage their progression through the pathway.
And do you see a lot of uptake? Do people interact? Are they interested?
Yeah, so We conducted a randomised clinical service trial in Salford. That was over a 2-year period. It's quite a limited set of people, but we've just taken that forward to the National Digital Diabetes Prevention Programme, which is about to go live imminently. So we're participating in that.
Fantastic. Now, with diabetes, it's a little confusing, and being a doctor, type 1 diabetes, type 2 diabetes, I know there's big increases in type 2 diabetes that's driven by lifestyle choices and things like that. Can you just explain a little bit about it?
So both types of diabetes are an issue with insulin. Type 1 diabetes, which is classically called juvenile diabetes, tends to happen to children. But it can happen in adults as well, and it's a failure of production of insulin. However, type 2 diabetes is slightly different. It's the development of resistance in the body to insulin, and there are certain things that will put you at risk of that, including things like obesity. So that's why, as obesity rates increase and as diets worsen, we're seeing this increase in type 2 diabetes in the UK.
So, Paul, now I've got a better understanding of diabetes. Are you targeting all diabetics, or is this particularly focused towards type 2
so
diabetes?
this is around type 2 diabetes. So the World Health Organization advises that 90% of people who develop type 2 could have prevented it through lifestyle change intervention.
Wow, that high, 90%?
Yeah, absolutely, yeah.
That doesn't surprise me, actually.
So, in terms of the services you're offering, do you look to target at-risk categories as well as people that have already developed type 2 diabetes?
No, so this is specifically about people at risk, so they will be identified through their GP or health checkup.
So they're pre-diabetic?
They're pre-diabetic, so this is about preventing them going on to develop type 2.
Wow.
So you need that information from the clinicians first, fed into your system, and then you reach out to the
Yeah, so we work in partnership with the NHS actually. We work with the NDH Care Call team in Salford. So patients will be referred in by their GPs and they will then be taken through a process to check that they want to participate in the lifestyle change intervention. And then they're registered onto the solution and they go through a 9-month coaching period using the solution and telehealth to provide that change.
I mean, without this kind of intervention, there isn't enough in the NHS, there isn't enough resource to provide advice, support. This is something that needs a lot of input, really. A lot of education.
Absolutely.
People wouldn't have access to doctors and nurses to do that. They just have too much to do.
It's for the rest of your life, isn't it? It's a non-curable disease. I mean, what's the medical term for it? Is it not chronic or?
So diabetes is a chronic condition.
It is
it's
a chronic condition.
long-term condition, but it can be managed if you put those lifestyle changes.
But the burden to the NHS
is huge.
Is massive.
Absolutely. So prevention is certainly the key.
So incredibly worthwhile for us. And can't wait to see what the outcome is and how well this program develops and hopefully gets rolled out on a national basis. Is that what you're hoping for?
That's what we'd like to support, I mean, the pilot will look at a number of different providers who've got different, methods or approaches to delivering intervention, and so we're quite excited to see the results of that. I think different people have, probably accommodate different types of solutions. I think you'll get a balanced portfolio being brought out by the NHS in the future. But I'd quite like to see as well how they integrate the digital solutions into things like community, so actually making resources available around patients to affect their lifestyle change. So cooking classes, activity classes, things which help them to adopt it into their normal lives. So I think that's where the future is downstream.
So it's fantastically...
I think it's great, and it's not something you would normally associate with such a big brand like Hitachi.
No.
It's great to see work in this space, in this positive space. Right,
So, Paul, would you like a question from our medical quiz before you go?
Go on then.
How is your general knowledge about the body and health related?
Not that great.
Not that great?
Not that great.
Okay. Glossitis is the inflammation of which body part?
Oh, wow.
I have no idea.
Guess?
Glossitis. Foot.
Other end of the body.
At the other end.
Other end.
It's actually the tongue.
Okay, very good.
But we'll give you a prize anyway.
I think so. I think that was a little bit cool. Anyone other than a doctor, would you really know that? You'd have to be a pub quiz champion.
I'm being a bit harsh, aren't I?
Thank you.
Here we go.
Thank you very much.
Chocolate prize.
Cool.
Thank you so much.
Thank you so much for joining us and
was a
telling us
pleasure.
all about this. What is the name of the campaign? And if anyone out there is watching who is within the pilot area, how can they find out more about this?
So there's a recent press announcement by NHS England. I think it's My Healthier You, and it's the Diabetes Prevention Programme digital stream. So they can find out about the national pilot there. And our solution's called Hitachi Smart Digital Diabetes Prevention, and there's information on our website about it.
So, digital diabetes prevention. Look it up.
Thank you.
Thank you so
much,
much.
Paul.
Thank you.